Barbara Kemigisa is 24 years old and an HIV/AIDS activist. She tested HIV positive 2 years ago. Barbara has managed to get where she is today with no formal training in the drive to help young people living with HIV and AIDS cope with the disease.
The fact that I've gone through most of their challenges and I know I can speak to them through experience, not because I have the knowledge. My experience is the best thing I hold.
Unlike many other people who are easily shattered at getting the news that they are HIV positive, Barbara saw her plight as an opportunity.
I'm born again and I asked God to help me, whichever results come, to help me use them for His glory. And when they told me I was HIV positive, it was something very fine with me. I just asked what I was to do to live.
Unfortunately, she wasn't able to save her baby from catching the virus, being a single mother with no support from the father of her baby.
My daughter is now HIV positive, much as she was born negative. But simply because I could not afford to look after us, I had no other alternative but to mix breastfeed and bottle feed. It was really a very hard time because I had left home. Found that my daughter wasn't supportive in any way, so time came I slept on the street, had days with no food, and time came I stopped my ARVs.
Barbara's experiences go back before she was diagnosed with HIV. As a child, she was sexually abused by her male relatives.
I was young. I didn't know it was sex. I didn't know anything about sex.
Later in high school, she struggled to cope with sexual addiction.
My senior 3, senior 4, I had sex, like I could have sex with any guy and I didn't mind about it. But I realized that's not when I got it, because earlier, like in P7, I got some rashes, I felt sick.
Usually, a community's reaction to someone living with HIV can have a huge impact on that person's life. If the reaction is hostile, the person may be ostracized and forced to leave their home or change their daily routine. But despite rejection from friends and family, Barbara has confronted stigma head-on.
My role is to tell someone, don't look at what someone is going to tell you. Because I look at myself, I have every potential everyone else has. You know, I have big dreams. I don't even have anything wrong with me, like I'm HIV positive. I don't look HIV positive. So I don't see any reason as to why I should feel bad about myself or I should let anyone make me feel bad.
HIV/AIDS stigma is said to have consequences in the fight against the epidemic. It can lead to governments not taking fast, effective action against the epidemic, while on a personal level it makes it more difficult for people trying to come to terms with HIV to manage their illness. In Uganda, like elsewhere, AIDS stigma is still very much in existence, mainly because HIV is associated with already stigmatized behaviors such as homosexuality, drug addiction, and promiscuity. The fact that HIV/AIDS is a relatively new disease also contributes to the stigma attached to it.
So many young people have support who are positive, have all the support, but they have self-stigma. But this self-stigma, you realize it comes because the public makes them feel like, you know, you're going to die tomorrow.
Activists point at more AIDS education and increased access to treatment as essential steps if discrimination is to end. Anna Tukunda, NTV.